Dear friends of Norway and Estonia, ladies and gentlemen, it is my great pleasure to welcome you today on this virtual business event. Norway has always been one of Estonia's most important partners. Our relations are strong because of common interests and shared values. This is where I thank everyone here for your contribution in making this relationship also economically beneficial. Today, I do not have an easy message for you. The crisis is not yet over, and there is still much uncertainty about the near future. On the other hand, crisis brings us new opportunities to find better solutions to develop our cooperation. By working together, we can recover more quickly and make progress on areas of mutual interest.
Thank you, Prime Minister Ratas. And with this, we will actually move on to the main segments of the day. So first of all, we will have HealthTech, followed by CleanTech, and then in the end, FinTech. After each segment, we will actually have a short break as well with a very special musical treat for you. And now, with this, we will move forward with the HealthTech segment of the day. I will give word to Mrs. Lina Svensberg from the accelerator program at DigitalWell Ventures and Mr. David Holm, investment manager at DigitalWell Ventures.
Thank you very much for inviting us to meet Estonia, the virtual state visit from Estonia to Norway. My name is David Holm, and I'm the investment manager at DigitalWell Ventures.
And my name is Lina Svensberg, and I'm the program manager of DigitalWell Ventures.
So we're here today to talk about DigitalWell Venture, which is a dual location accelerator between Norway and Sweden, where we work with health tech digital startups within the fields of emerging tech and all kinds of digital e-health kind of solutions. And I'll get back to the details pretty soon and see how DigitalWell Venture can work with the Baltic states and Estonia in particular. But before that, my colleague here, Lina, is going to tell a little bit about DigitalWell Arena and how this all fits in.
Yes, DigitalWell Arena is a 10-year initiative funded mainly by the Swedish Innovation Agency with a budget of total 15 million euros, and it runs over 10 years, and we are within this initiative addressing the challenges that we face within digital health and welfare. We're able to try to increase the use of digital technology and data in the vertical of health. And that is something that we do together with universities, with the public sector, with the private sector, etc. And that initiative has given us the opportunity to also work with startups within digital health. And David, could you tell us a little bit more about how exactly do we do that?
Exactly, and starting with the challenges that we actually do address, we're talking about, for example, public tenders, where we see that startups and small companies in general have a tendency to be left off because the big companies are accessing most of the contracts and the deals. So what we want to do is to ease the flow of purchasing from the government, and we're doing that as a part of the actual program, where we actually work with the government on one side to enable startups to actually qualify for tenders and participate in tenders, and at the same time we're offering the startups to have real-life test beds, so they can actually test their MVP live at public instances. That could be municipal test beds, it could be regional hospitals, or even state-driven initiatives.
And so tell me a little bit more about, now we're talking about the collaboration with the Baltic countries. We're saying that we're addressing startups in the new Nordics. What do we mean by that, David?
Exactly. First of all, I must say that it's very important for us to define what is the new Nordics. And most of you here today know that we have the Nordics and we have the Baltics, but the term new Nordics is actually quite new. And this is where we include the three Baltic states to the Nordic status. And why do we do that? It's because we think we have very close cultural integration between our 8 countries. From our own, how shall I say, egoistic perspective, looking at DigitalWell Ventures, we need to have a strong quality of deal flow. And the Nordics is too small for that. But when we include the Baltics and the quality that we've seen in the Baltic startups, I think we really have something going here.
Definitely. So tell us a bit about the deal flow. I mean, we are not only just an accelerator, are we?
Exactly. So basically, what we're doing is that we're working with the government as well. So sometimes official government entities have a problem that needs innovation. So that's actually part of the accelerated thinking as well. It's not only demand driven by one side, it's also from the government and from the startup. So for example, if the government have a problem, we can actually include that problem into the accelerated thinking, and we can actually come up with a solution together with the startups. So it's a two-way problem-solving entity, so to speak.
Exactly, and what we can do then also is that we can help the government communicating the demands that they have. I mean, it's not so easy for the startup to know how to tick all the boxes that are needed in order to address for example, a hospital as a client. And we can facilitate that communication, which means that we can make it easier for the public sector to communicate their demands. And we can also make it easier for the startups with testing it in the public sector, but also educating the receivers on the other side on how you test digital solutions and how you can feedback that. Which means that we can actually use a lean startup approach into a business to government setting, which is fairly unique.
Now we're talking a lot about test beds, Lina. Obviously, there's a lot of challenges as well as opportunities in participating here. And if you look at the USPs, the unique selling propositions that we have in DigitalWell Arena, what we say is more USP rather than just the test beds. Is there other things that makes our offering unique?
It definitely is. I mean, the geolocation setting that we already have with the collaboration between Sweden and Norway means that you get 2 markets straight away. So the internationalization is kind of included in the package. We also have, instead of an incubator, which normally runs over a couple of years, and an accelerator program that runs over maybe 16 weeks, we have merged those 2 concepts into a 10-month program where you 1 day a week you focus on the accelerator work, and then you have 4 days a week to run your normal business. What other USPs do you see, David?
Well, apart from obviously the testing and the flexibility in the program, I think the cross-border sort of approach to it, not only between Norway and Sweden, but also between the Baltics and the Nordics. So obviously we're looking at deal flow from all 8 countries. We're looking at innovation when it comes to academic cooperation. We're looking at we're working around the pentahelix model, which means that we have to include investors as well in this. So looking at investors in 8 different countries, I think it's a very interesting proposition from startups from 8 countries as well. So we pull that together and match it. So I think cross-border collaboration between the 8 countries is extremely important. Definitely. Okay, so to all of you out there, we actually invite you to get in touch with DigitalWell Ventures, and whether you're a startup, you're an investor, you're a government entity that needs help with innovating on a problem, get in touch with us and we'll help you out.
Yes, thanks a lot.
Thank you very much. Thank you.
Thank you, Lina. Thank you, David. And with this, we are actually coming back to our studio here in Tallinn. I have on stage here with me Ms. Piret Hirv from the Connected Health Cluster.